So the topic is no COVID, no COVID. That means I want you to understand certain basics of this particular topic, because a lot of discussion is going on about COVID-19 in general. And in fact, the lay people have become cleverer than the doctors, and they know much more than our medical fraternity. So it is better that we are updated. And for that, the basics have to be very, very clear. Otherwise, everybody is discussing about IL-6 and D-dimer, but nobody knows from where it came and why is it being tested. Okay. Now you can see that I am the professor at a medical college. I am not the head of the department. I am not HOD, because HOD along with the post brings hypertension, obesity and diabetes, which are the risk factors for COVID-19. And that's why it is better that we remain only at the level of a professor. And remember, the first disclaimer is that whatever I am saying today may not be true after 1 week, because every day the knowledge, the information is changing. But in that, as wise pediatricians and general practitioners, we must try to find out what is the wisdom from that. Okay, a lot of information will come. Everybody is speaking. The scientists are bound to speak. The researchers are going to speak. The politicians are going to speak. So many people will speak. But we should remain whatever is the formula of treatment and approach to a particular person. So that much. Don't tax your brains with hundreds of strains of mutants and so many other things. Just relax and know that there is a mutant strain which is circulating. Now, what is the number and all that is, something from which you should, as far as possible, try to keep away unless it is necessary or you want to give a talk like me at some forum. Okay. Now, remember, every pandemic has been a great teacher. And if you look at the word corona, this particular pandemic is no exception. And we have received a lot of courage to fight for the last 1 or 1.5 years. We have got an opportunity to read the literature on the disease. We can reflect about our life and the daily needs now. We can observe discipline. We never thought that we would wear masks in our lifetime. We have definitely come nearer to our dear ones and the family. And we have definitely started calling our relatives more often. In fact, I keep calling my teachers and old schoolmates also. And now we can anticipate and prepare for the future crisis. Okay. Remember to use the word challenges. Don't use negative words like problems, a tragedy, a pandemic which has devastated the world. Don't say that. That will make your mindset negative. So it's a challenge. And the main challenge is that we cannot go out of the house. There is excess of family time. So the husband is bored of looking at the face of the wife, and the wife is bored of looking to the husband's face. Everybody is face to face for 24 hours. There is social isolation. Negative thoughts are rampant, and there are withdrawal symptoms from many things. Okay. And there are some obsessive compulsive disorders in those who are prone for that. Okay. And the doctors are also under stress. They have a fear of transmitting the virus to the family. Quite a few doctors have stopped going to the clinic, and the workforce in the hospital, in the clinic, the nursing staff, ward boys, they have gone down. The elderly doctors above 60, 65, they are thinking as to what to do now. The colleagues are falling sick, or some of them are no more. And in case if the doctor tells the patients that I am positive, then there is a stigma. They are afraid that the patient will probably stop coming. And also they are worried about their income. So many things. And in children, remember, as they are not going to the school and they don't have the playmates and there are no other outdoor activities, it's a big problem for parents as to how to channelize their energy. And the news items from the television are all negative. And that's why I always tell my parents to watch the news items on their mobile phone, but don't make it a public show in the entire living room. And children are worried whether this corona will come to my house and whether I will die. And so many thoughts are coming in the minds of the children. Okay. So we must know as to when we were enjoying, in the latter part of 2020, and we were thinking that now this COVID has gone, it has come back. So why did it come back? Again, the answer is hidden in its own name. We became casual. We started moving around. We went to the malls and the gardens. We became overconfident. In fact, in the pediatric clinics, I never expected that children would transmit it to me. But, somewhere in the end of February and the beginning of the March, I remember quite a few parents, they started bringing the children. And when they used to go out of the clinic, They used to speak to the receptionist. Oh, one of our relatives was positive with COVID about a week back, and we wanted Dr. Jog to confirm whether the fever that the child has is because of COVID. And remember, many of our colleagues were caught unaware by such attitude of the parents. We became more verbose. We became indifferent to the sanitization practices, and of course, the different strain which was more infective than the earlier ones. So what we are discussing these days about the second wave, which is more serious than the first, the number infected is much higher. The total number of children is proportionately more. Okay. The mutated virus is in a setting where the population was casual, and it spreads very rapidly. And last year, where there was only one member in the family, here the whole family is getting affected in a short time. And the symptoms and the signs of COVID-19 are non-specific, and they mimic any other illness. So let us first try to understand as to what happens in this particular illness. Let us take an example of a thief which is going to enter into a house which is 25 storied. Why 25 storied? That I will tell you in a minute. Remember that the thief has come, and as the virus is coming. Remember, this thief or the virus can only get transmitted from humans to humans. Okay, it cannot be transmitted by any other method. Number two, it cannot replicate outside the human body. So these two facts you must remember. And it will replicate only if the ground is there for replication. For example, I will show you a matchstick which is there in my hand. Can you see this? Now, this matchstick, which has a red tip at the end, this red tip of the matchstick which is there at the end, this, in case, suppose let us assume that this is a virus, if I hit it on a surface where there is no way that the virus can create a problem, it will not burn. But if it gets a proper ground to get activated, then only it will burn. So whenever a person who gives chance to the virus to get inside, then the virus starts replicating. For example, the nose which is unclean. Suppose the person has so many deficiencies, he has immunosuppression. So the virus is waiting, okay? Otherwise, it will come and go. It will come and go. But otherwise, in case if the person has immunosuppression or some factor which we always discuss, then it will enter. What it will do? It will do two things. One, because I gave the example of the matchstick and the matchbox, remember, it will create a fire. It will create a fire. Aag laga dega. Okay, that is number one. And number two, it will order the cells of the body. Once it enters into the respiratory system, it will order the cells of the respiratory system, particularly the lung cells, to prepare its own copies, like the Xerox copies. Okay, so the same nucleic acid material, it will as if dictate the body to prepare newer and newer copies of the coronavirus. These are the two things. But the point is, this virus is a very, very sincere virus. What it does, it's a very methodic virus. Though it's a dangerous virus, it doesn't stay in the body beyond 7 days. Okay, it will enter into the body. It will put the entire house set up the house into a fire, and it will go after 7 days. What remains is the problems which are created by this fire. Okay, so the chowkidar or the security which is moving on the road, as soon as he sees the virus, as the virus enters, he will bring some interferons. Okay, then he will call some other colleagues. These are the local ones. These are the tumor necrosis factors. Okay, then it will call some other people from the society, and these are the interleukin 10s. So all these will come over there. But when it becomes unmanageable, the people in the house will say, no, I cannot tolerate all this. Let us call the police. And the police usually sends the first one, and that is the IL-6. This interleukin 6 will stimulate the liver to produce CRP, that is a C-reactive protein. Okay, so these are the markers of inflammation. These are the effects of the fire which this particular virus has set up. Very important. Now we will see this example of this fire and the house. Again, we will continue with that. So first, try to understand that this disciplined virus. Why disciplined? Because after 7 days, it will not stay. Okay, we know that for certain. 7, 8, 9, 10 days, the virus is no more in the body. So during first 7 days or 10 days, when the virus is there, this is a phase of viremia. That means the virus is in the body, in the blood. This is the time when the antivirals are going to work. So the adult physicians who use favipiravir or they use remdesivir, these are all antivirals. So obviously, if the child or the parents, if the relatives, the adults, if they come with COVID positivity in the first 7, 8, 9, 10 days, then only these medicines are going to be useful. So that is the first principle that you must remember. This is very important. Now, when this virus enters into the nose, I'm just trying to explain so that you know the basics of this. Look at, there are, these viruses, when they enter into the nostril, one of them I have just a ball pen which is blue, other one is orange. They are going to enter into the nose, the viruses. So some of them will go up into the nose, up, and they will never go down to taste. And my dear friends, if you get loss of sense of smell or taste, which is so pathognomonic of COVID-19, be rest assured that you are not going to die. You are not going to have lung COVID or a serious problem. Remember that. But if this virus enters down into the respiratory tract, then again, it has two ways to go down. So either it will go down into the lungs down, or it can go to the GI tract. If it goes to the GI tract, again, you are fine. Don't worry, because 30% people with COVID-19 have GI tract manifestations in the form of nausea, vomiting, abdominal pain, and diarrhea. But they won't die. They will recover. Okay. Only those remaining ones where the virus enters into the lungs, they are the ones who will have this problem. So this is what you must understand. Now, the mistake that our people do is, as soon as they come to know that the thief has entered and there is the house which has been set on the fire, rather than putting off the fire, rather than taking care of the damage done by the fire, they keep calling very senior people from the police. That is, they indulge themselves into doing RT-PCR. Okay, in children, my dear friends, remember, the RT-PCR, though it is positive, the disease is mild. In 80, 85, 90% children, the disease is not going to be serious. So don't run after doing PCR. Don't try to run after superintendent of police. Okay, don't call him. First, see what is the damage done. First, see how the child is behaving in the first 3, 4, 5, 6 days. Whether his fever is increasing, whether he is not eating well, whether he is dull, whether he is getting breathless. So remember, these are red flag signs which you should remember. So don't go after. But in case of adults, what happens? These problems, they persist. The fire keeps burning. And even after 2 weeks, 3 weeks, 4 weeks, people go into what is called as a post-COVID syndrome and a long COVID syndrome, which we are not going to discuss, because fortunately we are pediatricians. And I always say fortunately, because our problems are very minimal, because majority of them have a mild problem. So remember that the virus can affect the respiratory system, provided it is a respiratory system of a person who is giving a chance to stay. Okay, and there are ACE2 receptors, the angiotensin converting enzyme 2 receptors, which are nothing but proteins, and the virus specifically goes and attaches to these. Okay, and these receptors are present not only in the lungs but other parts of the body also. So wherever these receptors are present, the virus will start creating a problem. Okay, and as it enters into the lungs, why I told you 25-storied building, because those of you who are aware of this HRCT and the CT scans, there are 25 marks. So the virus will go from 5, 10, 15, 20, 25. So depending on the number of floors of this building affected, we give a score and we say that it is up to 8 and up to 8 to 16 and 16 to 25 and so on and so forth. But my dear friends, please keep away from HRCTs in pediatrics. After 1, 2, 3, 4, 5 days, in case if the fever is not coming down, then do the hemogram and the CRP and the X-ray of the chest like a good pediatrician. Okay, don't run after HRCTs. One HRCT is equal to almost 25 to 30 X-rays. We will try and see some of these points in a minute. So I wanted you to understand as to what is the basic problem in this particular virus. So this is, what I would say, down the coronary lane. Corona has left so many memories right from 31st of December 2019, when many were enjoying their year end. And this is the structure of the virus. Very interesting. It's a beautiful virus. But remember, all the beautiful things in life, they come with many, many problems. The rose will come with a thorn. Similarly, this particular virus comes with a storm. Okay, isn't it? So look at the virus carefully. It's not a difficult slide to understand. Just remember that there are 4 proteins. And the most famous one is called as the spike protein, S. You can see in the middle, spike protein. This spike protein is the one which is going to attach to the ACE2 receptors. That is the one which is used to prepare the vaccine. You can also see that in the center of the virus, there is a protein which is a nucleocapsid protein. Okay, so this particular protein is the one which is connected with the nucleic acid material. And there are other proteins called envelope protein and a membrane protein. Now, obviously, when the virus enters into the body is going to produce antibodies. These, by this RT-PCR, which we do by the nasopharyngeal swab, usually will detect the virus. So that is the antigen, isn't it? That RT-PCR or the rapid antigen test that we do. These are the detections of the antigens. But when the antibodies are produced after about 2 weeks or so, these antibodies will be against the nucleocapsid, and they will also be present against the entire virus as such. Okay. Now, if you take a vaccine, you all know now that the vaccine is produced, manufactured by using the spike protein. So when you get the antibody levels after taking a vaccine after 2 weeks or so, you will get the antibodies against the spike protein. We are not going to discuss much about the vaccine today. If time permits, we will have some questions and answers, because today's aim is to know COVID. You have to have the knowledge of why we are doing what we are doing. That is the purpose of this talk. And for some of you, it may appear very simple, but it is important that you understand, because quite a few doctors continue to use the terminology without understanding what's going on. And that's why I remember these 4 proteins. And now on the right side, you can see that there is that ACE2 receptor. Try to just rather go closer to the screen of your mobile or the laptop and see that these are the lung cells which have these ACE2 receptors, and the spike protein, you can see, has attached itself to this receptor. Now, the structure of this virus is, like a ballistic missile. You can see so many, that blue, the green, the different colors which are shown in this particular figure. Now, this virus, RNA virus, is notorious to mutate. Mutate means sudden change. In the garden, there were all roses which were pink, and suddenly on 17th of May morning, there is a black rose. That's a mutation, isn't it? So the virus changes. All the RNA viruses, including influenza virus, they change, they mutate. And remember, there are plenty of mutations which have been detected. End of September 2020, the mutations started being detected from London. And then they have been detected all over. In Maharashtra, it started from Vidarbha. And then later on, now rest is the history. And most of us know about the mutations. So now, if you see the blue color on the left-hand side, that is called as NTD. That is the N-terminal domain. Okay. And this is the representation of a spike gene indicating the key mutations which are a cause of concern. And that's why these are called as variants of concern. So VOC. So that is the name that you must remember. And remember, they require to be monitored in India. And there are various subdomains of the spike gene which have been shown in the colored boxes. And I have shown them some of the names which are there. If someone is interested, I can always pass on some of these slides if you are interested. But you did not break your head on the, just remember, the mutations have been there in different parts of the country. Now, why is it important to know that there is a mutation in the COVID-19 protein? Because this substitution of a particular position in the protein is going to create a problem. So these mutants are the ones which are transmissible and infectious and more virulent and lethal. Okay. That's why during this pandemic, in a family, we are getting entire family getting affected, and the transmissibility is very high. The person last year who used to infect 2 or 3, these days transmits the infection to almost 8. This is called as the basic reproduction number, and that is R0 in epidemiology. Okay. Now, this can also reduce the efficacy of the drugs. It can escape the immunity due to the pre-existing infection. Many of us thought that last year, 2020, I got COVID. No, I will not get. But this second one, the mutant one, has proved it wrong. Okay. And it can cause reinfection. Now, people thought that, this particular mutant probably will be taken care of by the vaccines also. Yes, it is true to some extent. However, these mutants can escape the immunity provided by vaccines. And this can also reduce the sensitivity of the PCR test. However, particularly if the PCR targets the gene, where the mutation has happened, then only this would happen. Otherwise, the PCR test, even with the mutants, will come positive. Okay, now let us come to a little more clinical aspects, and we are going to see as to how these particular presentations this year have been different than the last year. Now, one thing, what are we seeing during this year? Number one, there is increase in the severity in the young adults. I'm just telling you some general things first. Number two, very rapid progression in certain patients. The upper and the middle and the rich class has been affected more. Okay. And obviously, we know that there is paucity of oxygen and medication and ICU beds. And there is, a lot of fatigue in the healthcare workers. They are tired of working. And there is a lot of irrational use of antivirals like favipiravir and remdesivir and antibiotics. In fact, WHO has given an opinion that this particular pandemic is going to be the one where antibiotic abuse is going to be maximum. Okay. And there has been also excess use of steroids. You will be surprised to know, my dear friends, that the steroids are really, really being used right, left, and center right from day one in different parts of our country, simply because people do not know the exact time when the steroids are to be used. Right at this moment, let me clarify that when a person worsens, when it becomes a disease where the fever is not going down for 4, 5, 6 days, 7 days are over, that is the time when we are worried now that the fever is not going down. Probably that particular fire example that I told you, the fire is still persisting. The virus has gone. Okay, there is no viremia, but the fire, the impact of fire is there. That is the time when fire is equal to inflammation. And that's why that is the time when we are going to use steroids. So my dear friends, before 7 days, please don't think of steroids. Okay, except in exceptional cases. But remember that up to 7 days, please withhold steroids. Why? Because steroids will increase the viral replication in case if you give it on the 3rd or the 4th day. So please, in case if you are, in the periphery, please withhold steroids unless, there are definite indications, which we will come and see in a minute. Okay. So remember that you should suspect COVID, particularly whatever we are discussing now will be related to pediatric practice. So if there is a child who comes with fever, headache, myalgia, fatigue, tiredness, cough, coryza, sore throat, rapid breathing, any one of these, remember that this pandemic, the problem is more for the adolescent age group between 9 and 19. Okay. And that's why we have to know that these complaints can be told by an adolescent. There has been also diarrhea, vomiting, or abdominal pain. Okay. And it's a diarrhea which is quite bad. Diarrhea is quite bad. And that's why when you're doing fluids, calculate the fluids on hourly basis because the diarrhea is quite severe. Then poor feeding in an infant, a small baby will be lethargic, will feed less, and there will be loss of taste or smell, particularly if the child is above 8 years. Remember, in adults, loss of sense or smell or the taste is supposed to be a good indicator. As I told you, person won't die if he has this virus going up, which has created a problem. It would create a problem. However, this can persist in adults for 3 months, even up to 7 months. It can come and go. And many times I tell my colleagues who always complain of this particular loss of sense or smell, direct hospital is So if there are friends who complain that Pramod, I have a loss of this particular taste of or smell, then I tell them that you better go with your wife in the garden and just take some roses and see that you smell them. It's the best opportunity for you to be together in the garden, or take the smell of unusual things which you never smelled in lifetime. Many times, people have the loss of taste for sweet. So that is the best thing. So those of you who are diabetic, they can always switch over to stevia rather than using sugar. That is the best opportunity to change your lifestyle. And of course, we will not be discussing much of adult COVID, but at least for children who are above 8, this is a pathognomonic feature. And then there will be rash or conjunctival congestion or mucositis, that is the involvement of the mucosa, or in a child who is little older in age or adolescent, he may come in shock. And there are conditions which are called as multi-system inflammatory syndromes. Multi-system, that means more than one system is involved, and there is inflammation which is quite rampant, and child may come in shock. Okay, or sometimes the child may be asymptomatic, but there would be a contact with COVID. So all these are the presenting features. And what you should remember is that the fever this time is longer, it is higher. Okay, it is lasting longer, more than 4 days, 5 days. Okay, otherwise for other fevers, till now what we were telling parents, don't worry, it's a viral fever, 1 or 2 days or 3 days, the child will all right. But if the fever doesn't go down by 4th or the 5th day, then you have to be alert, and then you can go ahead with the rapid antigen test. And I will tell you about it in a minute. Okay, remember that this is the child who came to the OPD, and I just wanted you to see this point which I told you, conjunctival congestion. Okay, if you see this in a child who has fever, please remember this is likely to be COVID-19. The problem with this virus, as I told you, is that the nose COVID or the throat COVID can directly become lung COVID, because that is having a rapid progression. Okay, and you can see a child who has fever usually will come directly with cough. Okay, because the virus is directly attacking the alveolar cells. Now, when a child comes to you with fever, who are the ones whom you should test? Remember, there is a lot of burden of this testing in the machinery, in the government as well as in the private sector. So do not send small children, pediatric age group patients having fever of 1 or 2 or 3 days just for the sake of checking. I know so many parents, they came positive, and there was a child in the house who had nothing, absolutely nothing. They said, no, just because we came positive, we thought it is better that we are aware whether this child is positive or no. So we did that. Okay. Ideally, yes. In case, if at all you are suspecting COVID in a person, these are called as suspect cases. Yes, you can do it. But, you have to use the wisdom. Knowledge is there that it is, to be done. But then you have to decide. So in a family where father and mother both are positive, the child is absolutely fine. Just to rule out COVID-19 in the child who is asymptomatic, please don't do these tests. Even if the child is symptomatic, what are you going to do? You are going to give only paracetamol for the initial 2-3 days. And usually by 4th or 5th day, the children usually settle. And I'm sure this is the experience of many of us who are listening to this program. Okay. However, there is only one point. Suppose in case a patient becomes serious after 5 or 6 or 7 days, at that time, it becomes very difficult for the parents to get the report, because hospitals are not getting patients admitted unless they show the report of RT-PCR. Of course, these cases they are not very high, and we have to weigh the situation and then decide. In case if there are comorbidities like diabetes, or a child is very, very obese, or if he has comorbidity, he has some other problem, then the stories are different. Okay. Of course, before any procedure or hospitalization, as I told you, we may require the testing. In case if the resources are scarce, then you can defer the testing. Okay. And remember that in case if you want to just correlate the pathology of COVID along with the clinical features, these are 2 important slides that I'm going to show you. The initial phase in the first few days is symptomatic. Symptoms are present: cough, cold, fever, throat pain, myalgia, loose motions, all that I told you. And following these symptoms, the patient is going to recover in the 5 to 7 days. But this is a non-pulmonary phase. Okay, non-pulmonary phase. The lungs are not involved. Some patients can remain totally asymptomatic throughout the disease process. Okay. 85% of patients recover from this state due to innate immunity. Okay. If your innate immunity is good, if you are eating balanced diet, if you have variety of food, if you are taking good 8 to 9 hours of sleep, you are exercising well, and you are a healthy man or a woman, then remember that you are going to recover, because I told you that the virus will affect only those who will give a chance for the virus to enter. Okay. Otherwise, I told you, aega, jayega. The virus will come, it will go. It will not get a ground to settle. But if it comes, then it will create a problem, may create a problem. Okay. So pathologically, in this state, there is predominantly viremia. I told you, first 7 days, viremia. Okay. This is the stage when the antiviral therapy will work. And the second one is the symptomatic pulmonary phase. Okay. Clinically, this is the stage where we have respiratory symptoms like the fast breathing, drop in saturation below or 94%. Okay. And here there are 2 pathological processes which are always spoken of, and that you must remember. Okay. this is the time. That means wherein the 7 days are almost over, and there is immune dysregulation. The immune system is not regulated. It is behaving in an erratic manner. And this is the time when there is a cytokine storm. Okay. And this can have two presentations. One is called as L type. What is L? There is an enzyme called as elastase, which is low. Okay. So this is a pulmonary phase, which is called as early phase. This is L type. And there is a late phase, which is H type, where there is high elastase. Now you'll ask me, what is the importance of knowing all this? Remember, simply, many of you must have heard of ARDS, okay, or the respiratory distress syndrome in the newborns also, wherein the compliance of the lung is lost. As if, the balloon is so hard and you are trying to fill in air in a balloon, which is simply having no elasticity. Okay, that is ARDS. That's a severe stage. That is a late stage where the elastase is high. But in the initial phase, where elastase is low, here invasive ventilation can be avoided. And here the anti-inflammatory and the anti-thrombotic medications, they play a major role. Now we have spoken about inflammation, but we have not spoken about the anti-thrombotic, because the word thrombus has come. Remember, when the police came at that time, they told the people in the house that, see, now we have ordered the liver, the CRP is coming, and now so many things are being done. The water is being thrown onto the building, and they also brought some cement to repair the areas where the building was damaged. While this particular cement, which is nothing but the fibrinogen, okay, was being used, little bit of cement, that when the laborers they work, cement falls down on the ground. These are the degradation products of fibrinogen. These are called as FDPs, fibrinogen degradation products, and one of them is D-dimer. Okay, one of them is D-dimer. So D-dimer, remember, is a product like this, and that is what we are speaking so often. So now I told you that IL-6, ferritin, D-dimer, all these are nothing but the inflammatory markers. I just wanted to tell you the basis behind this. Okay, now which tests? I just told you that the testing should be done. Suppose a child gets fever, cough and cold, it should be done as soon as possible after the symptoms. Okay, immediately. Okay, in case if the child is asymptomatic, and if there are people in the family who are symptomatic and RT-PCR positive, then usually the testing could be deferred or done after 5 days. Now this rapid antigen test in the nasopharyngeal swab is done. Remember, this particular test, rapid antigen test, if it is positive, please do not go for RT-PCR. Once positive means it is positive. Usually, in case if it is negative, then only there are people who, of course, should go for RT-PCR, real one. And RT-PCR also can be done in different ways. And if there is expert, just as the gene expert, which we do for diagnosis of tuberculosis, and the true nut, they give the faster results. However, only one patient can be tested at one time, but the results are really faster. Okay, and as I told you, when this particular fire which was there in the house, it has still not been over. It has been there, but now the antibodies have been produced. The virus has gone, but the remnants of the fire are still there. And this particular inflammatory process which is going on, so the virus has left, some antibodies. So the virus was the antigen, the antibodies have been left out. And at the end of about 2 to 3 weeks, you will come across these antibodies. And at that time, if multiple systems are involved, then usually it is called as MISC, multiple inflammatory syndrome, multi-system inflammatory syndrome associated with COVID. We will see a few points about this, though I will not complicate the matter much. So remember that the initial test is a rapid antigen test. If it is negative, then go for RT-PCR. Okay, and after 2 or 3 weeks, if a patient comes with fever and very serious state, then many times we are to do these antibodies, because by then the antibodies develop. So last year, whenever we had those cases of multi-system inflammatory syndrome, that means a fever going on for 2 or 3 days along with other system involvement, then at that time antibodies were positive. But during this particular variant, second wave, we are getting serious cases of COVID-19 even at the end of the first week or on the 6th or the 7th day. So that is severe COVID presenting like MISC. The only difference is that in the initial phase, we have involvement of the lungs. I told you, while in MISC, which comes after 2 or 4 weeks, there is no lung involvement. Okay. Now, what are the other things which you should know about RT-PCR? Now, the children with symptoms suggestive of COVID-19, but negative test should undergo repeat RT-PCR, but not more than twice. Don't keep on doing, people feel, nahi, abhi ye positive kaise aata nahi dekhta hu. Don't be having that spirit. Only twice you do it. And if the symptoms are protracted and the RT-PCR is negative, please remember to find out alternative diagnosis. There have been reports where dengue has been seen along with COVID. People thought it is COVID, and it turned out to be dengue. At some places, it turned out to be enteric fever. Okay, so all our good old friends are very much there. So please remember that. Now, depending on the severity, it is very simple to divide this COVID in the first 7 days into 3 categories. Only symptoms are there like fever, sore throat and rhinorrhea and cough and diarrhea and vomiting. And the breathing is normal, no fast breathing. It is mild disease, very simple to understand. If there is fast breathing, okay, and there is hypoxia, the saturation is less than 94, okay, but the disease is not severe, only breathing is fast, like our pneumonia, okay, this is moderate disease. And in case if there is hypoxia, saturation less than 90, the child is in distress, grunting, retraction, and other seriousness signs like lethargy, seizures, and excessive sleepiness, and severe diarrhea and vomiting and abdominal pain, or some children, as I told you, who have that ARDS like presentation and shock, then you have to call it as a severe disease. Remember that. So it's very simple that lung involvement could be related to 2 things. I told you there is one early phase and there is a late phase. This all correlates with the lung involvement. Okay. And the management, my dear friends, is so simple. I fail to understand as to why we keep on discussing so much. It is what I called as a COVID appropriate treatment time. Okay. So it is so mathematical that first 7 days, I told you, it's all symptomatic treatment, which I'll be telling you. If fever persists longer, or if there are signs of hypoxia, or in case if there are radiological evidences, then you are going to go either with oxygen or with steroids. And in the first 10 days, I already told you, the antivirals will have only place. Okay. Even the plasma, which was being used and not, of course, being used now, that had those antibodies. Obviously, they were aimed at the virus because the antibodies wanted to neutralize the virus. But after 10 days, what is the role of plasma? But I don't know why people still keep discussing about plasma. So the treatment of mild illness, for your convenience, I have just prepared a mnemonic called patient. So what is that? Paracetamol and symptomatic treatment. Like in case if there is a nasal block, use saline drops. Antibiotics if necessary. Teleconsultation. For all patients with fever, cough and cold, give teleconsultation. Protect yourselves, okay? Because this virus is highly transmissible. So in case if you are sure that you are wearing a double mask and a face shield and giving a consultation with an acrylic sheet and only one relative with one patient and all, that's fine. But otherwise, take care. If possible, give teleconsultation. You have earned a lot till now, and there is no need to run after the OPD day in and day out. Okay. So at least fever, cough, cold patients, teleconsultation. Other patients, abdominal pain, constipation, and neonatal examination, well baby checkups and immunization, that's okay. For that, you can go. Otherwise, please advise them to get the child isolated at home, and others in the family. Okay, like the parents, they must wear a mask because children are known to be the spreaders. Ensure the hydration and give breastfeeding. And obviously, everyone has already understood that there is no role of certain medications which were being given in the last pandemic. And though there are reports about utility of many of these products, remember, many of them do not have a good supporting evidence. Okay. Multivitamins, which include vitamin C, D, and zinc, they may be given, though they are of no proven value. Okay. But remember that you have to tell the red flag signs like persistent fever, rapid breathing, breathlessness, dropping saturation below 95, lethargy, drowsiness, and poor feeding. Now, in children, it's very difficult to use this pulse oximeter. But obviously, if a child is playing at pink, there is no need to use this pulse oximeter. So use your head, and please tell the parents that count the respiratory rate when the child is nicely sleeping. Okay. Otherwise, a crying child and so many other things, as pediatricians, we know it's very difficult to assess some of these parameters, though, people have to be told that this is the respiratory rate which you should be worried about. Okay. Now, remember that if the fever persists for 3 to 4 days, it could also be because of some other reasons apart from COVID. And for that, the complete blood count, CRP, urine examination, blood culture for enteric, chest X-ray for usual pneumococcal pneumonias and others has to be done. Okay. Now, if there is a comorbidity, remember, if there is an access to healthcare, that's fine. But if there is no access to the health facility and a child has comorbidity means all those conditions that I told you, diabetes, obesity, liver, renal, and so on and so forth, cardiac and all. So they have to be admitted and managed as per the guidelines for comorbidities. Some people use ivermectin, and remember, it inhibits the replication of this virus in the cell culture. And it may interfere with the attachment of this virus spike protein to the human cell membrane. However, there is no pediatric data for the use of ivermectin, and the safety in children under 15 kg has not been well established. Those certain guidelines maintain ivermectin, and that is particularly for the adults. Now, in case if the child comes with a moderate disease where the respiratory rate is high, there is hypoxia, maybe, may not be, and there you have to remember that you have to admit this child. You have to investigate by doing the complete blood count. You might have to use remdesivir and others. That's why you must be ready with the renal and the liver functions. You must have CRP, because I told you CRP is an important marker of inflammation, and chest X-ray to find out whether there is severe involvement of the lungs. And this particular investigative profile could be repeated at 48 to 72 hours as per the clinical condition. Again, here, if the saturation is above 94, only respiratory rate is increased, but no hypoxia, hydration, paracetamol, and maybe antimicrobials. If the saturation is down, then you have to give oxygen, IV steroids, plus minus remdesivir, plus minus antimicrobials. Remember, the treatment is mathematical. You have to use your own wisdom. Okay. Guidelines are only to guide you, and remdesivir is to be given only in the hospital settings. This has been a very popular drug of late, and there are dosage guidelines for children between 3.5 kg to 40 kg. This can be used even in a child with weight as less as 3.5 kg. And the dose on the first day is 5 mg per kg, followed by 2.5 milligrams per kg from day 2 to day 5. Okay. And children above 40 kg, as in adults, we give 200 milligrams on day 1 and 100 milligrams from 2nd to the 5th day. And I told you it has to be used within 10 days of onset of symptoms. Okay. And it is contraindicated if the liver functions are deranged or if the renal functions are deranged. Okay. And my dear friends, steroids are many times given, particularly in the indications that I told you, in the dose of 0.15 mg per kg of IV DEXA, maximum 6 milligram once daily for 5 to 14 days. But you have to stop it at the time of discharge. And other steroids could be used in special situations like methylprednisolone for MISC and others. Antimicrobials commonly used are amoxicillin or coamoxiclav or ceftriaxone, wherein you feel that the child has, in addition, bacterial component to the pneumonia. And remember, there are medications like enoxaparin, which we'll be speaking again, and there are dosages given for children under the age of 2 months and above the age of 2 months. In case if the child is severe or critically ill child, then it's a different ball game. And then this child has to be in the ICU or the high dependency unit, and you have to have all the parameters, which I told you earlier. Procalcitonin is the one which we know that increases in the bacterial infections. But here, if there is no bacterial infections, remember it has a negative predictive value, because in case of this COVID-19, it can come high in the latter part. The D dimer, which I told you, the arterial blood gases, lactate, ECG, chest X-ray, all these investigations in the ICU. And then if needed, we can go ahead with the further investigations as per the clinical condition. Okay. Now, remember, my dear friends, that if you find that the child is critically ill or severe, it's not your ball game. Please see that these children are in the pediatric intensive care unit, and please do not interfere in the management. Okay. Because it is something which has to be managed by the specialist, the intensivist. As I told you, there is a mischief that MISC stands for the multi-system inflammatory syndrome, and there are 3 components. M is multi-system, so many systems are involved, which I will tell you. There is inflammation, and it is associated with COVID. So you must have the evidence for multi-system involvement, evidence for inflammation and evidence for COVID. And in addition, there should not be any other infection. So the definition which is given by WHO is very simple to understand. It's a problem of children under the age of 19 who have fever for more than 3 days and any two of the following criteria, like rash or bilateral or non-purulent conjunctivitis or mucocutaneous inflammation signs on the mouth or the hands or the feet, hypotension or shock, features of myocardial involvement or pericarditis, valvulitis, evidence of coagulopathy or gastrointestinal problems. So you can see that there are multiple systems. So it is different parts which have been involved. So any two of these can be taken. So it is the multi-system. It is inflammatory. So the ASR is elevated, CRP, procalcitonin are elevated, and there is no evidence of other microbe causing inflammation. Okay, like there is no sepsis, there is no staphylococcal involvement, there is no streptococcal shock syndrome, nothing. And there is evidence of COVID-19 in the form of RT-PCR positivity, antigen test, or serology. I told you, after 2 or 3 weeks, antigen has gone, but the antibodies are present. However, there are cases where you find in 1/3 cases you get antibodies, 1/3 you get antigens, and 1/3 only have the history of COVID-19 about a few days back. So, these are the various things which you must know. And there is a management protocol for COVID-infected newborns, which you must know. Remember that in case if there is a COVID-infected newborn, there is no need to test the baby if it is stable and asymptomatic and born to a COVID-positive mother. The baby can be kept in the same room as the mother if the mother wears a mask and washes her hands regularly. Okay. Even if an RT-PCR is conducted and the baby is positive, it should not be admitted in the condition is stable, but kept in isolation with the mother for 10 days. And there is no need for other tests thereafter. Mother can breastfeed the baby even if she is on anti-COVID medicines, except for Fabiflu and doxycycline. Okay. If the mother is critical and in the ICU, the baby can be taken care of by some COVID negative family member, and the express breast milk would be preferred way of feeding in such babies. And the infant tests negative but has antibodies from the mother. Sometimes it happens that the mother gets infected in the last trimester, okay, and the baby only gets antibodies and the baby is sick. Then of course there is a rare entity which is neonatal multisystem inflammatory syndrome. Of course, keep away from that because it's not very common, though our colleagues have seen some cases. Okay, and in severe cases, obviously the baby has to be in the neonatal intensive care unit, specifically for COVID positive neonates. And you have to treat the newborn as a normal sick newborn with maybe antibiotics and regular ventilatory care if required. And with steroids, a good outcome is known. And IVIG and plasma role is not yet established in the newborns. Again, newborns, please involve our neurology friends, and the baby can be discharged without any RT-PCR if it recovers following the treatment. Okay, and there are guidelines which are released by our neonatal forum as well as the FOXI for the pregnant mothers. So remember that the patients with fever, cough, and cold have to be given teleconsultation. And the instructions to be given to the patients before they come to the clinic. Only one relative with the patient. Wait into the basement or in the car or outside the clinic unless you are called inside. Use a double layer mask. Do not insist on checking the throat and checking the chest. Get the vaccination done or get the examination done and go out. And all these things which are well known to our colleagues. And remember, please take care of the staff members by giving them good quality N95 masks. If we have some other opportunity, we will be discussing the clinic management in the present situation. However, the common scenarios which you come across must be known. One of them is where the parents are positive and the child is negative. Now, many of the parents, they feel that the child is negative, so let the child go to the grandparents and stay with the grandparents. Please do not commit that mistake, because these children could be carriers. They could be asymptomatic carriers in the beginning, and they will infect the grandparents who are in the high risk category. Okay. Sometimes it so happens that the child is positive and the parents are negative. It so happens, but then it is prudent and wise that the parents use a mask in the family so that they themselves do not get, because again children are the spreaders. However, in general, remember by day 3 or 4 children recover very well, and I already told you the guidelines when to go for testing. And remember, vaccination must go on. Usual vaccines in the first and the second year have to be given, and please allot them a separate appointment at a particular time and see that the vaccination of the particular child and in turn of the entire country doesn't suffer. My dear friends, avoid lists of medicine which are being given. Now, this particular physician has given the diagnosis of COVID suspect, even it is not confirmed, and it has 17 medicines in the prescription, and it includes all the medications, whatever probably, whichever probably came to his mind in this prescription. So please keep away. Only good thing in this prescription is that this gentleman has given the red flag signs, and in case of emergency, where to report. But my dear friends, really, children require only paracetamol and nasal drops if required, and some antihistaminics if required. But remember, there is no need of a majority of the medicines in children because they recover very well. Okay. So my dear friends, asymptomatic children, there is no need of active treatment. Second wave of COVID, children are equally affected as adults, and manage them, because as some children, particularly adolescents, may land up in pneumonia and cytokine storm. The problem which is occurring more in the age group of 9 to 15, the persistence of symptoms along with high CRP, even if the saturation is normal, indicates high chance of developing a cytokine storm. Okay. And I told you that the multi-system syndrome cases are increasing, and early detection and the management is important. Okay. It needs an aggressive approach, and there is a major role of pulse dose of steroids and IVIG together. And there are biological agents which can be used for detection of this cytokine storm early before development of hypoxia is important. My dear friends, the vaccine probably will not have time to discuss today, but as I told you, the vaccine, Pramod vaccine, is available 24/7. What is that? Have patience, be on the crease. People are telling you that the virus is going to get tired. Okay, everyone wants to live. When entire human race is after this virus, how dare can he stay for a long time? He has to run away or become milder and get out. Okay, sometime or the other he will get out. Have resilience, have art of survival, be absolutely positive. Don't make others negative by telling stories of अरे ये तो कल तक अच्छा था, ऐसे कैसे हुआ, अरे ये तो सिर्फ 30 बरस का था, गया. So don't say all these things. Make others positive. Organize your day. Keep away from social media as far as possible. And if any problem is there, do not hesitate to call me on my number. Remember, you have to gear up for practice. Don't be afraid and cheer up. Okay, it's a wave. And the wave always recedes. You have gone to the seashore. No wave continues to be there as a wave. It has to go back. Okay. And remember, you have to ration the resources. Remdesivir. Ration the use. Rationalize your treatment. Behave like a good rational pediatrician and be resilient. The doctors as well as the patients both have to be resilient. And I will just end my talk with a prayer saying that God grant me the serenity to accept the things that I cannot change, and courage to change the things that I can, and wisdom to know the difference what I can and what I cannot. Meaning thereby, you have to prepare for a third wave, because third wave is something where I can do certain things which I can prevent in future. So there are our colleagues who are working to prepare the guidelines for the third wave. And that's why, my dear friends, I will stop sharing. In case if there are any questions, please feel free to ask, and in the available time we will just try to answer those questions. Thank you.
Thank you for this wonderful presentation. We have a questions in the question answer chat box.
Yes.
Yes.
I can see that there are more than 75 questions, and I don't know how many of them are questions, how many are comments, but maybe if you have some facility, please note them down. And you can ask me the ones which you feel are relevant.
Yes, sir. Sir, there is one question from Dr. Yeluri. How to differentiate early COVID from upper respiratory tract infection?
there is no way to differentiate early COVID from the upper respiratory infection. Remember, COVID is a disease associated with a lot of weakness. If you have only rhinovirus, it will have runny nose, but the child will not be fatigued. He will be playing around. Okay. A child who has flu, for example, influenza, he's a fatigued child. Okay. Many times influenza will produce weakness and muscle pain, particularly influenza B produces more of muscle pain. But this COVID virus also, many times, I told you, the only way to differentiate is that fever will have cough, a dry type of cough in majority of cases. See, medicine is not always 100% perfect. So you may say, no, isko do sardi bhi thi. That's okay. But dry type of cough along with fever. Okay, fever which is not coming down. It's going on for 4 days, 5 days. Usual viruses, they say, bye-bye, aag nahi lagayenge, nikal jata hu. I don't want to be troubled. But ye banda jo hai, it will try to persist, produce fever for 4 to 5 days. So remember that, and in older children, of course, as I told you, it may produce loss of the sense of smell and the taste. Though it's difficult, but you have to be on watch. And these days, all those coming with fever, cold and cough, we are taking them to be COVID unless proved otherwise. So it's prudent and wise to, follow that principle and look with high index of suspicion. Only thing is, children will not create a problem in the first 7 days. In majority of cases, they will recover. But tell them that there is a condition after 2 or 3 weeks for which the child might have to be brought to the clinic again. So if a child starts getting fever after 2, 3 weeks, 4 weeks, and if the child has symptoms, I told you, related to that multi-system syndrome, then my dear friends, please tell them to come back. There are some different symptoms which I told you, and there are the 5 groups which I told you. Particularly the GI symptoms are to be remembered after 3 or 4 weeks. Thank you.
The next question is oral steroid versus inhaled steroids.
See, in the first few days, 5th or 6th day, if there is persistent cough, then in the adults, they have been using inhaled budesonide in the dose of 800 micrograms twice daily. In children, there are not many trials. However, as I told you, in older age, above say 12 or 13, there is no harm in using, and that is definitely showing a good result. That much about pediatric category. However, the more evidence, as slowly and gradually we learn, will be available.
There is one question from Dr. Samir Das. You said antivirals to be given in earlier days of the disease.
Yes.
And in cat, you are saying favipiravir, etc. has no role. What is to be done?
Yeah, I told you that favipiravir and remdesivir, out of these, favipiravir is used more by the adult physicians. It is also an antiviral. There are some experts who have shown that the duration of hospitalization with favipiravir comes down by 2 days, but that is mainly in adults. Okay, in children, there are no studies. Remdesivir also is useful, and there are studies which also tell you that the duration of stay goes down. However, the point is, what some of our colleagues, including us, all of us in our institutes, what we have started saying is that for a child who has fever going on 5 days, 6 days, and he's really not well, remdesivir really works. Okay. Now, what has happened is that people are running from pillar to post to get remdesivir. However, the situation is improving. But one should remember that if a child is not improving, there is persistence of fever, in absence of hypoxia, you have to keep a close watch on the markers. And the only marker which is available in only 8 rupees is CRP. Okay. There is no need of spending 4,000 rupees on the HRCT. I gave you the example of 25-storied building because 25 is the number in the CT scan. Okay, I told you that. So remember one important point, that in case of children, remember that remdesivir will be required only if there is persistence of fever, hypoxia, and increase in the inflammatory markers. Decisions are to be totally taken by the treating physician. It is easy for me to say, sitting over here, remdesivir, please use sparingly, rationalize the use. But then when it comes to that particular child, that particular parent, and that particular physician who is treating, it is extremely important that he takes the decision looking at the child as a whole. And we always say that do not treat the reports, treat the patient. Okay, so looking at the patient makes the difference. Okay, so whatever we are telling you, these are all guidelines. So there is nothing 100% perfect in medicine, as I told you earlier. So one has to be very, very careful and individualize the treatment. And that's why so many webinars going on. Every person, every physician is giving his own experience, okay, of managing children in the early phase, then in the 7 to 14 days, after 14 days, discussion on MISC, so on and so forth. Okay.
The next question is from Dr. Sneha Rupa. Sir, do we have a screening tool where resources are restricted? Like a rapid test is unavailable or RT-PCR takes more than 4 days. What should we do in such setup?
In children, my dear friends, please do not run after the superintendent of police. I told you already. Okay. First, observe the child. Look at the red flags. Only if the child is not doing well, then you go after some of these tests. I don't think rapid antigen test is a problem these days. I think at many places it is becoming available. However, I would strongly request you to remember CRP. Very important. There are values of CRP above 40. Particularly, you have to be careful. And if they're above 60, you have to be really careful. Remember, CRP will be giving you an important, inflammatory marker. And you need not run around ferritin and LDH and D-dimer and IL-6 and others. CRP is more. And for adults, my dear friends, there is one test which requires 0 rupees, and that is the 6-minute walk test, okay, which we have not discussed because we are not discussing the adult COVID today. But remember, just walk for 6 minutes, have your oxygen saturation before walk, after walk, and if it drops by 3, a figure of 3, from 97 it comes to 94, then you please be aware. There are many things which we can discuss, but of course we have to be innovative and find out our own answers for our own questions. Yeah.
The next question is from Dr. Vishwanath. Indication of anticoagulants and when to stop.
Particularly, yeah, remember in children, it's, as I told you, this D-dimer value more than 3 times is one of the indications. However, it is to be given in children in the hospitalized setting. And I told you that D-dimer, as I told you, is a fibrin degradation product. And as an anti-inflammatory marker, you have to keep a watch. And along with others, you have to give it in the hospitalized patients. It is given subcutaneously, and later on, it is continued in the oral form.
Then there is one question you already answered in your presentation about breastfeeding. If the mother is positive and child is negative. Then about when the parents are positive and child are negative, what the precaution has to be taken. So you already covered in your presentation. Same things. There's one question from Dr. Shekhar Patil. If CRP remains still high after completing the treatment and subsiding symptoms, what to do?
Keep a watch. Remember, the level is important. If it is hovering around 10, 11, don't worry. As I told you, if it is above 20, between 20 and 40, keep a watch. Above 40, be careful. And if it is above that particular up to 100, then you have to be really worried. It's an important marker. You know, there are 2 things. One is the quality, that is the CRP level, and other is the quantity. Okay, both of these are important. I told you the example of the fire. The fire is burning. Okay, it is still there. The virus has already gone, but intermittently, the fire which is there somewhere or the other comes up. It surfaces up. Okay, and that is why people keep getting fever. The inflammatory markers are, higher to a little extent. But for that, the only answer is keep your thermometer away, particularly in adults. Okay, if otherwise you are well. Otherwise, people keep worrying about fever. 98.4 ho gaya. Remember, if it is above 100.4, then only you have to worry. Some parents, they come to me these days and say on the first or the second day, sir, he say meetha bukhar hai. Now, this meetha bukhar is a term which I have never understood. But the point is, they always say, but keep a good quality thermometer and monitor the temperature. Only if it is above 100.4, you need to monitor more closely.
So most of the questions are you already covered in your presentation. They
Okay.
are repetitive one, and they are wanted some knowledge on vaccine. If you could spare your 2-3 minutes on the same, so that will benefit all the delegates.
Yeah, actually, I knew that the time required for COVID-19 discussion itself will be, not adequate. That's why I did not touch the COVID vaccine. And as it is in pediatric age group, the vaccines are not yet approved for use,
Right.
except for a few from the Western countries like the Pfizer and others who have started it. Remember that vaccines are going to protect you from this particular virus. Number one, they are definitely useful. So remove all the ifs and the buts and the doubts from your mind about the efficacy of these vaccines. Okay. Remember, the spike protein, which I told you in the virus in the initial slides, that is the one which is used particularly in this particular manufacturing process. One is that the body of the virus, so some part, the genetic is taken from that virus, that is the body of the virus, and a cap of adenovirus is put onto that. Okay, so body with a cap, that is the cap is put of the adenovirus. Now the body knows adenovirus, and that's why the body is fooled. So the body knows that adenovirus has come, so let me produce antibodies. But under that adenovirus, under the cap of adenovirus, there is this nucleic acid material. Okay, so unknowingly the antibodies are produced against the genetic material of the virus. Now remember that the portion of the virus, the spike protein, has a representation in the nucleic acid material. So that particular nucleic acid material is taken. These are all technical details, but I thought as it is we want to know COVID, you also must know what is a vaccine. So that's why I told you that. Anyway, in India, there are two vaccines. One is Covishield, which is manufactured by Serum Institute of India. And that is the one with that chimpanzee adenovirus, the same technique. And there is a whole cell killed vaccine like our DPT, that is a co-vaccine produced by Bharat Biotech. Both vaccines are very good. You have to take 2 doses. If you take 1 dose of Covishield, the second one is to be taken after 12 weeks, but not 16 weeks. Okay, 8 to 12 weeks is okay. 12 weeks is ideal, because after 12 weeks, the immunity given by the vaccine, first dose, if you take the second dose after 12 weeks, you say, no. Some people are saying that it can be taken between 12 to 16 also. No, because after 12 weeks, the immunity starts going down and down. So not beyond 12 weeks. That is for Covishield. Okay. And for Covaxin, the second dose should be taken after 4 weeks. Okay. And you can take it up to 6 weeks also. Both the vaccines are good. Some of my colleagues will always ask me, if I have taken only 1 dose of Covishield and now this vaccine is not available, now what happened? And then I went here and there. Remember, even 1 dose of Covishield has been proved to give 79% protection in trials in Chile. Okay, remember that. So it gives good protection. Okay, no problem. There are some people who have a question that I took the first dose and after about 15-20 days, I myself got COVID. So what do I do now? Now wait. Initially, people used to say that you have to wait for a month after you recover from COVID. Then you take the next one. But now the guidelines are that you wait for 12 weeks. Okay. And in fact, the registration itself is not being done before 84 days. So, that is something which all of us probably know. About vaccines, I will be giving another talk after about 2 days, maybe if possible. You can circulate the information, and there I will be discussing all the details about the vaccine. However, as of now, remember, take any vaccine, but take the vaccine without fail. Now, there are people who ask me whether pregnant women can be given the vaccine, whether vaccine can be given to lactating mothers. The answers, if you were in US, it is yes. But in India, the answer as of now is no, because any vaccine which has been used, now Pfizer vaccine has a good efficacy against COVID in US. But even if it is brought to India, there is DCGI approval which is required before you can give it. So the straightforward answer is no. Okay. Now there are ways out. People will always tell me that no, I will just give the vaccine to the mother, she is lactating, but I will not disclose that she is lactating and all. Now, these are things which people do as per their whims. But then the straightforward answer today For pregnant and lactating women is no, because it does not have DCGI approval, though it has recommendation from some medical bodies like Foxy and others. So these are recommendations, but no approval. Okay, so remember, be clear about it. Otherwise, if you get some problem, you will land up in a medical legal problem, and then you will remember this webinar forever. Okay, remember that. Okay.
Thank you, sir. Thanks a lot. You extensively covered the pediatric COVID in your presentation. I guess most of the delegate will have their answer for the queries, and it will go into helpful for them to treat their pediatric COVID patients. So once again, sir, on behalf of the Alembic family, I would like to thank Dr. Pramod Jog, sir, because this Pedia talk cannot be complete without his presence and inspiring words. Also, I want to express my heartfelt gratitude to all the delegates present today. I would like to thank the organizing Mega Care marketing team and sales teams for this successful conduction of the event. Thank you, sir. Thanks a lot.
Okay.
Thank you so much, sir.
Okay.
Thank
If
you so
possible,
much.
yeah. If possible, you can have a mechanism to write down some questions from the chat box. I don't know whether
Sure,
there is
sir.
a mechanism, so that quite a few colleagues have questions about role of oseltamivir, and so many questions are there, which of course I could not answer because of lack of time. So some questions from the chat box and from the question and answer section could be noted down. Maybe if possible, we can try and answer them back. Okay.
Sure,
Thank
sir.
you.
Yeah.
Thank you.
Thank you so much, sir. Thank you so much.
Thank you.
Thank
So
you all
I
the delegates. Thank you, sir.
I thank all of you, Alembic Mega Care, for this particular program, and also all the colleagues whom I can see and cannot see for attending this function and the event. Thank you.
Thank you, sir. It's always delight to have you on the talk.
Thank you.
Where lots and lots of new things that we learn from you as a professional also. Yeah. Thank you so much, sir, for connecting with us again.
Thank you.